So this experiment is designed to help us understand why crystals grow with a higher quality in a microgravity environment compared to their earth-grown counterparts. There are two existing theories, but we haven't really proven those theories. We know we get better crystals from space, but the purpose of this experiment is to understand why. We've designed the experiment such that we take these proteins, three different proteins, and we have the protein as a monomer, which means one copy of the protein that's been purified, mixed with different percentages of that same protein but stuck to itself as either a dimer or a trimer. On Earth, we always have some of these aggregated copies of the protein mixed with the monomer. It's hard to eliminate them, and they get incorporated into the crystal. But we believe because of microgravity and the lack of buoyancy-induced convection, microgravity actually acts as a filter where the crystal predominantly is grown from the monomers. The reason for that is that the dimer, without buoyancy-induced convection, is only moving based on its own vibrational energy. It's in a diffusion environment. The larger a molecule is, the longer it takes it to get to the crystal, to move through the solution and attach to the crystal. A dimer is going to take much longer to get to the crystal than its monomer. As a result, crystals grown in space, we believe, are going to be predominantly made up of monomers, less of that dimer or larger aggregates. But why is growing a crystal in space important? Well, we expose those crystals to X-rays here on Earth at synchrotron facilities, and when we do, what happens is the higher the quality, we see more detail in the structure that we determine from that X-ray pattern. In other cases where proteins play a role in diseases, having the structure of the protein helps us tailor make a drug. It's like a key going into a lock. The lock is the protein, and it may be a certain shape, and the drug has to fit into that shape and have the right charges, right interactions to very specifically bind in that particular area of the protein. So having that structure allows us to make a compound or a future drug that more precisely fits that protein and not other proteins in our body. If it interacts with other proteins, then we get unwanted side effects. So that structure is very important for helping us design a drug that's very specific for that one protein that we want it to interact with. So the process of designing a drug based on structure, the name for that is structure-based drug design. And today, that's been very valuable for many of the drugs that are currently on the market and many that are currently in trials. For example, the three drugs that are used today as a cocktail to treat patients that have HIV infection were all made using this process of structure-based drug design. In terms of just crystallography, which is the technique that allows us to determine the structure, when I was a student 25 years ago, to do a structure of a not very large protein, say a protein with a molecular weight of 100,000 Daltons, it took about 15 years. Today, if we have a high quality crystal, the day we collect the data at a synchrotron facility, a large X-ray facility, that day we can actually see the structure of the protein. So it's rapidly advanced the ability to determine the structure if we have a high quality crystal. 60% of all the past drugs that have ever been developed were developed to target membrane proteins. These are the proteins that sit in the outside part of our cells. They're the membrane portion. They're the most difficult proteins to crystallize, and we now know from one stellar example where a membrane protein was crystallized in microgravity and ended up allowing them to see the structure of that protein that they couldn't get from the earth-ground crystals at that time. It's predicted that 60% of all future drugs are going to be targeting additional membrane proteins. Examples are many of the cancer targets today come from the membrane portion of our cells. Cystic fibrosis, the key protein that causes that disease is a membrane protein. So there are many like that. Pretty much most diseases you can think of, there's a membrane protein that probably plays a role. Being able to get structures of these would be so important. If you look at the history of crystallography, there have been now over 100,000 protein structures done, but those were aqueous proteins, not in the membrane. In the history of this science, There have only been about 80 membrane proteins that have been done. Why? It's very difficult to get good crystals of those proteins. Using a microgravity environment to perhaps improve the quality of those crystals can help us perhaps get structures of some of these proteins that we were unable to get on Earth. So the LMM provides the data that we need from microgravity, and that data is using the fluorescent microscope to really see how much of the dimer is being incorporated into growing crystals, along with measuring the growth rate of these crystals while they're in the LMM. So two pieces of information that are critical. When the crystals come back, we're going to look at the quality as we have done on previous space flights using X-ray diffraction. So combining what we do on Earth with what the LMM will allow us to do in space will let us really understand how space is producing better crystals.